Health is well placed as number 3 on the list of Sustainable Development Goals, and the declaration emphasizes that to achieve the overall health goal, countries must achieve universal health coverage and access to quality health care. It is therefore hoped that the National Health Insurance Scheme Bill, if passed into law, would act as a catalyst to achieving the universal health coverage. The country developed the National Health Insurance Scheme Bill that was passed by Parliament in March 2021. Unfortunately, it was not assented to by the President, allegedly on grounds that some issues had not been reconciled, including the concern by employers that contributing for workers would increase their operational costs. During the 6th National Community Health Financing Conference, organized by Save for Health Uganda, the Director Curative Services at the Ministry of Health, Dr. Charles Oraro, maintained that consultations with key stakeholders to seal gaps in the proposed National Health Insurance Scheme Bill are complete.
The return of the bill back to the ministry has enabled us to be able to consult. We've been able to engage the members of parliament, we have been able to engage the private sector, and I'm sure now that there is consensus. We will build a consensus, and I'm sure that many things which we have been able to get into a win-win situation. The rest of the other issues definitely will be in the regulations.
The Executive Director, Save for Health Uganda, Frederick Makaire, stresses that if the country operationalizes the National Health Insurance Scheme, it will reduce on out-of-pocket expenditure on health care that stands at 40%.
As people who are promoting community health financing, we are very much behind this because we see everyday struggles that families go through in trying to finance health care. It is very costly for them. We know that, of course, there is free health care in government facilities, but many times there are situations when they go there and the services are not available, drugs are out of stock, so they end up actually footing the bill. But the unfortunate bit is that many times when they go to the hospitals, they don't have the money. So either they don't get full doses, they forego services, or they don't get the medications at all.
Opposition members of parliament are in consensus that the country needs a national health insurance scheme, but emphasizes that supporting local manufacturing of medicines will make healthcare more affordable.
Had we been manufacturing some of these things, so you will find that a good amount of this money that we are putting together will go in procuring medicine, but at a higher cost. So shall we have some of those other things catered for in the law that maybe we should start getting into these other areas? So those discussions we shall have, of course. When we are discussing, we are not alone.
Uganda is the only country in the East African region without a national health insurance scheme. Adiana Kote, UBC.